You're listening to the Wired for Impact podcast.
Once we do the blood test and the evaluation, and when I talk to the patient, I tell them, okay, this is what I found. So I'm going to take an example. Let's say you have hypogonadism, low T. Now we're going to decide, is testosterone replacement a good option for you? The one thing we have to make sure that we understand, for my younger patient, testosterone replacement does decrease fertility. So I have to have the talk with this. If they haven't had kids yet, testosterone may not be the best option for them. So that's when we may go with things like HCG, clomiphene, although I don't like it as much, but to more increase your own production of testosterone and to increase fertility. So that's the one conversation. If fertility is not an issue and you meet criteria for testosterone replacement, then we talk about the different options. We have, to me, the one I like the most is testosterone by injection. And now we can do injection with a very small needle, an insulin syringe. That is, can do either subcutaneous or intramuscular. And one thing we've learned about testosterone injection, instead of doing one big dose every week or every 2 weeks, we do microdosing. We split the dose into smaller sections, into smaller doses, because that's how our body makes testosterone. We don't make one big dose that slowly goes down. You pulse. So the more you can pulse, the more you mimic physiology. Mm-hmm. Besides injection, we also have testosterone cream, and we have different percentage of cream, different strengths. We have a sublingual troche, a tablet, also that can be used. So we have different forms. So it is really personalized medicine. Mm-hmm. Not one patient is the same. I sit down with them, I go over what I would recommend, and I give different options. And besides the testosterone, which is the main player, the most important one, you need the supporting cast of the right supplement, the magnesium, the vitamin D, the amino acids. So all of those things are important. Once you put all of those instruments playing together, it's a great symphony.
Can we talk real quickly about the side effects, maybe some of the negative side effects as well? I know some people are concerned that once you start, your body stops producing it naturally, and therefore you're having to be dependent on external testosterone.
So that's a great point, because a lot of people are stuck on this and are scared of it. So you're never dependent on testosterone. You can come off anytime you want. So when you take testosterone, it shuts down your own body production. That's how it decreases fertility. And in some cases, it can lead to testicular atrophy, where you have shrinking of the balls because they don't need to make more testosterone. So that's definitely a side effect that can happen. And the way we can mitigate this is that we'll put the patient on HCG or Clomid to make sure there's still some testicular stimulation. Now, let's say you just take testosterone by itself. After 6 months or a year, you decide you want to stop it. If you stop testosterone, your body will go down. You will experience a crash of T, usually by week 2 to 4, and you will feel it. You'll feel lower energy. You won't feel as good. But usually within the 6 or 8 week, you go back to your normal baseline. So if that patient came to me, their baseline testosterone was 300. Within 6 to 8 weeks, they'll go back to 300. If that wasn't good enough for you before, you just go back to not feeling as good as it used to be. Mm-hmm. But you never depended on it. Your body will go back to the normal. And what we do with our patients who want to stop it, we do what is called post-cycle therapy. They stop testosterone, I'll put them on HCG for 4 to 8 weeks to make sure they don't experience that crash of testosterone. Mm-hmm. But you will go back to your normal baseline. And I'm going to take me as an example. I started at 48. And at one point, I was like, I'm tired of injections. I think I can out-muscle this. I'm going to meditate, exercise, and eat well, and I'll be fine. Within 2 months, I was like, forget this. I need my mental energy. I need my physical energy. I'm not dependent on it. But I'm so much better when I'm optimized that there is no reason, if doing the right way, it's a win-win. You can feel good, look good, and I can protect your health long term.
Thank you for listening to this episode of Wired for Impact. If you're interested in creating and expanding your impact, be sure to visit us online at impactnow.com.